HIV treatment works. Get in care, stay in care, live well.
We have couples, yes, and especially for the discordant couples. Discordant couples is whereby we have one of the partner is actually HIV positive and the other one is HIV negative. So basically for them to remain negative, for the longest they would use condoms, because a condom is a barrier method. That means the secretions from either the man or the woman, they're not passed to the other person because they have that condom on, or that it's a barrier method basically. But now looking at you, we are looking at reduction of the virus. Viral suppression is whereby once we test the blood, that means the levels of the virus in that blood are below detectable levels. Detectable levels, we have our machines that are able to detect the levels of the virus in the blood, and at times they get undetectable. Undetectable meaning you've taken your drugs well, you've gotten to viral suppression, meaning the level of the virus has also gone down. If the virus has gone down, that means even when you're having unprotected sex in this case, the levels of transmission are also very minimal, because if you look at the fluids that are coming from the body, that means the level of the virus is quite minimal, and even transmission rates also become low. If you're not taking your treatment well, that means when you pick, or rather we pick that sample to test for the viral load, we have people even who have 1 million copy. And when you have millions of copies, that means the transmission rates are very high. So we are looking at getting to that, such that if this one person is taking their medication well, that means even if they have unprotected sex with their partner, that means that this person, chances of transmission are very minimal to this other person. Yes, because they're getting to that level of viral suppression. If someone takes their antiretroviral therapy well, they will get to the undetectable levels. Undetectable levels because they get to that suppression level. And ultimately, the main goal of taking our antiretroviral therapy is making sure that these patients get to undetectable levels. Once you take your treatment well, it's a combination of drugs that make sure that you get to that level of undetectable. And if you get to that level, that means even your chances of transmission are actually very low. Yes, so taking the drugs well, they'll get them to their undetectable levels. The only reason we may not get to undetectable levels is one, if we're having issues with adherence to medication. That is, if this person is not taking their medication well, then chances of getting to undetectable levels are become a challenge. The only other reason, which is not a common one, is when you have treatment failure. But mostly we get treatment failure when this person has not been taking their medication well, or in cases we have people use other drugs. So they may be using drugs that are not reported at the health facility. We've had people using either herbal drugs, those kienyeji drugs as we call them. And then we get interactions with the mainstream drugs that they're taking, or rather their ARVs. In that case, because of what we call drug interactions, then this person may have treatment failure. The drugs may not be working well. And that's why we always insist, if you're on any other medication, then you need to come to the health facility. Let the doctor know that I'm taking these other drugs. Let them look at the possibility of having drug interactions that may stop, or rather may hinder your ARVs from working well, because that would be the other reason as to why your ARVs may not work well, and then you may not get to the viral suppression, or rather, yes, the viral suppression that we expect you to get to when you're taking your ARVs well. So if we deal with adherence, if we deal with any other drug interactions, be it drugs, other drugs that you're using, you even advise on the food that you take. At times we have foods that hinder either good absorption of the medicine, or if you're having anything else, or even any other condition. We have conditions that also hinder absorption of drugs. So when you come to the health facility, you're just supposed to disclose that. Let your doctor know, I'm having either this condition, or I'm going through this, or I'm taking this other medication, to make sure that the drugs that you're given, your ARVs, then work optimally in your body. That time you're going to get to viral suppression. Poor intake of the ARVs, yes, that's what we call poor adherence. Then automatically you're not going to get viral suppression. And we say that when the virus is high, then your chances of transmitting or rather infecting someone else are very high. So even when you talk about mothers, if they take their drugs well, right from the antenatal clinic through their labor and delivery, and also during the postnatal period or rather the breastfeeding period, they are able to make sure that they don't transmit the virus to their child. And when you look at adherence also, even the child, once the child is born, they also get their own prophylaxis just to make sure that we curb the infection just getting to the child during the breastfeeding period, because they breastfeed normally like any other child until they get to 2 years and they're able to take their medication well, and we're getting HIV negative children. Yeah, so adherence is very paramount when you talk about ART or rather the antiretroviral therapy for any, not just the mothers, but also the men and also the children that we have. Yes, it makes a whole difference for them in terms of getting good health and also ultimately getting a quality health for them. Let's start by looking at even the local coordinators and the local speakers. We had Dr. John Onyech, who is actually an obstetrician gynecologist here in the country, working at KNH. So yes, men are involved. When you talk about women, it's not like we've done away with men. It's only that you're having a discussion on how to reduce the infection for the women. Men are equally involved. Like I said earlier, the transmission rates. Men are involved because they're the same people that these women are having sex with, and that's why we're having the transmission also to the women. So men are involved, and actually even in the conference we had a whole session discussing our male engagement. We need this man to come in, just like he's the head of the house. We need him to come in handy and support this woman to come to her antenatal care. We need him to support this woman to come in also for her care and treatment, whether be it she's pregnant or just breastfeeding, or even if she's not pregnant or breastfeeding, she's coming in for her treatment. Like we said earlier, this woman in the village who is HIV positive and she's a housewife, the man comes in handy to support her economically, just to make sure he facilitates her transport to get to the facility for her to get the treatment. And you're lucky enough to have our treatment free of charge, offered by our government. So that means this woman, if she gets to the health facility, she's able to get her treatment and ultimately get care in this health facility once she's able to get to the health facility on time. So men are very key in terms of just making sure that they facilitate this woman and also for their own health. Because by the end of the day, if you look at things like mental health, we're involving both men and women. When it comes to the family setups, we look at both the man and the woman in this home. We need them to be of sound mental health for them to make the right decisions, both for themselves and also for their children and for the whole family as a whole. So that's why we need this man on board to make sure that they're making the right decisions. We need this man in terms of him also being healthy. We've seen cases whereby we've lost the men as the breadwinners and the homes go down simply because the man never involved the woman, or he made all the decisions. And when this woman is not involved, or rather she's not even empowered to take care of that home, then things go haywire once we lose the man who is the breadwinner. So that's why we need the man. We need to make sure that he's getting involved in the health of the family, for the woman, for the children in that family, and also his own health. We need him to be there. And we are looking at having that voice of a man, so that if we call out for this conference, when we say it's women's health, the men should not just give it a blind eye and say they're discussing about women. No, get to know what is it about these women and how do I come in to support these women. Because we have these women in our houses. We either have these women as our sexual partners, we have them as our wives, we have these women also as our girls, our adolescent girls and young women. And that's the other discussion that you need to look at, because our HIV infections are very high also among our adolescent girls and young women. So as a man, do you have a say in the life of your wife? Do you have a say in the life of that your daughter? We need you to come on board and make sure that she's able also to get that prevention message. You want her to live a quality life, and it starts with you as a man. And also it starts with you by taking care of your own health before even you look at this woman who is taking care of her own health. So yes, let's have the men on board even when you have these discussions, just to make sure that we have these discussions across board. It's everyone's business. It's not just the woman. The conference was looking at ending HIV, pediatric. So I keep on referring to pediatric AIDS, but we also want to end pediatric AIDS. But we want to end AIDS by 2030. But far and beyond ending AIDS by 2030, we're looking at it in terms of the community. We also want to end HIV-related stigma. For the longest, once you mention HIV or once somebody discloses that they actually have HIV, it's like a death sentence. They are considered as outcasts in some communities. Nobody wants to associate with this person who has HIV. For the longest, because of looking at it that way, people have really hidden away from facing HIV in itself. So what we need the community first of all to know is that HIV is like any other disease. The same way you'd have hypertension, the same way you'd have diabetes, is the same way you have HIV. And the most important thing is like you'd just get your diagnosis of hypertension or rather diabetes, and you go seek treatment. Is the same way we want that if you're diagnosed with HIV, you also need to go and seek the treatment. And if you get to hear of this person who actually has HIV, you don't need to stigmatize them. You don't need to discriminate against them because they have HIV, because they're leading normal lives. What you need to make sure is that we embrace them and we support them to take their treatment, and make sure that they live quality and healthy lives. And that's the most important thing, because it doesn't end there. They still form part of this society. They still help us in building the society in their different areas of specialization, whatever it is that they do. So HIV should not be a death sentence. And when somebody has HIV, they should not be treated as an outcast, because anyone can get HIV. It's not a disease for a specific group of people. It's anyone who can get HIV. And when you're in those shoes, when you get HIV, then you need to get the support that anybody else can get with any other disease. Just make sure that they get their treatment and making sure that they lead quality lives. Basically, that's what we should be fighting for. So let's end HIV-related stigma across our communities. So the call for the communities to make sure that let's support anyone who has HIV. It's not a death sentence. They're not outcasts. It's not anything bad that they did. What they need is support. In the conference, we had so many stories of women. They give their stories of how they've been treated in the communities. They give their stories of how people also took advantage of them, just to make sure that either the community does not get to know that they are HIV positive, or even they get to get treatment. And we know that HIV does not have treatment as it is right now. So because of that, then they tend to be segregated in the community, which makes them actually, the stigma in itself brings about other issues like mental health, because we want to live. We are a social society. We are social beings. We need to interact with other people. But when people start secluding you, discriminating you just because of a disease, then it becomes very hard for you to live on a comfortable life. And you see the impact of this, even when it comes to children. Women are not able to support their children comfortably when it comes to discrimination, because this mother who is giving their child the antiretroviral prophylaxis, they're not able to give them openly, or just making sure that their children are also protected. They're not able to take their drugs comfortably, because if the next person sees them, either they'll be castigated by their own families, they'll be castigated by their friends, the communities at large, and even some places, the workplaces do that, which is quite unfortunate. So what we need people is that they can embrace HIV like any other disease, knowing very well that it's something that if they take their treatment, they're going to lead healthy and normal lives. So what we call upon the communities to make sure that let's reduce the stigma, let's support the HIV positive people, and you're going to live happy lives across board. Cases for the women are high, and what we need to work on, especially as a community, and what we're still struggling with as a country, we've not been able to get there, is the prevention measures. Like we said, because of things like the pre-exposure prophylaxis. These are ARVs that you take once you consider yourself to have a high risk of getting infected with HIV. And you're looking at either having that discordant couple and the other partner has not got into viral suppression. That means this partner, and especially like the woman, has a high chance of getting HIV. So they need to start using the pre-exposure prophylaxis to make sure that they don't get infected. If you're a woman and you have multiple sexual partners, then we need you also to make sure that you're using the pre-exposure prophylaxis, just to make sure that you also don't get infected with HIV. And these are some of the measures that you're really working on to make sure that they're embraced in the community. The fact that the pre-exposure prophylaxis are ARVs, then we've had issues with some of these women taking them up because they either consider them to be because they are pre-exposure, they are ARVs, then they consider them to be related to HIV. They don't want to take them so that they're not told that they have HIV. And it takes us back again to the HIV-related stigma, because you can't even prevent yourself from getting HIV because you fear what the community is going to say about you taking those drugs. So what we need to make sure is, and what we're discussing also, is like those things like pre-exposure prophylaxis. How do we make sure that the community in itself knows the importance of taking these drugs? How do we increase demand? As a woman in the community, if you know that your partner has multiple sexual partners and you know you need to protect yourself from getting HIV, how do you come to the facility, or what would it take you to come to the facility and ask for these drugs? Because you need to protect yourself from getting a HIV. So what are these combination prevention measures that we need? So what we need to make sure is that the community is aware that we have these drugs in the facilities. In the public facilities, they're available. So what we need these women to come is come and ask for them. Come and say, I have this risk, either have sexual multiple partners, or I know my partner has multiple partners. We've seen from our media even having people coming out to talk about polygamy. If you have polygamous kind of a relationship and your partner has multiple other women out there, we may not know how to protect ourselves, because every woman has her own the way they live their lives with this main partner. So how do you make sure that you yourself, as this woman in this polygamous marriage, then you don't get infected with HIV? And the only way is prevention. Just coming out comfortably and saying, yes, I have this risk, I need these drugs to make sure that I protect myself. And things like the pre-exposure prophylaxis, they're not lifelong. It's not like antiretroviral therapy when you're already HIV positive. We look at it in terms of ongoing risk. If there's that substantial ongoing risk and you know that you can get HIV infected, then protect yourself by taking pre-exposure prophylaxis. Once the risk is gone, then you can stop taking the pre-exposure prophylaxis. What you need to just make sure is inform your doctor that the risk has gone down because of this and that. There's a timeline that you need to take the drugs for the next 28 days, then you stop and you're okay. So it's all about empowering our communities to make sure that they can take up that initiative to come and seek treatment themselves and make sure that they protect themselves from getting HIV. And that's it about the prevention aspect. And if you're not able to use prevention like ARVs, the pre-exposure prophylaxis, then we also want to look at it in terms of are women being empowered to use things like condoms? So is she able to negotiate for safe sex? And safe sex here is, can I be able to use a condom? If you have your multiple partners, can you be able to use a condom to make sure that you prevent yourself from getting HIV? If you have, we've had our girls having one-night stands. We've seen the stories about our media with the Airbnbs and all. So if you're having such kind of relations, are you able to ask for safe sex? And this comes in handy. And especially if you don't know this person, then can you just use a condom just to make sure that you're safe? And that's what we need our community to know. The prevention is there. It's up to them now to come and seek the services in the health facilities because they're readily available. So demand creation, basically, you come in handy as a media house because once we talk about educating the masses, most people will listen into you guys, and especially when you have your news and all, just making sure that the community is aware that you have these things. It creates there's a lot of reliance on what comes in from the media, and what you need to make sure is we take advantage of the media and making sure that we educate our communities on what we have in terms of health. What is it that's available in our facilities? What kind of care can they seek and what can they get in the health facilities? And especially some of these things like ARVs, they are free and they're able to get them. At the facility level, what are we doing? We're making sure that you have a lot of sessions on health education. Most facilities, every morning during the day, you find there's somebody who's trying to talk to the people who've come to the health facilities, just trying to make sure that they educate them on what is available in our health facilities. It may not just be HIV materials that are there that day, but they get to be educated broadly on various aspects of health.